Ever experienced a sharp throbbing pain at the edge of your toenail? We're diving into a topic that's as common as it is uncomfortable: ingrown toenails. Now you might be thinking, it's just a toenail, how bad can it be? But this seemingly small issue can cause significant discomfort and impact your daily life. It's not just a minor annoyance, but a medical condition known as an ingrown toenail. So let's unravel the mystery of what's really afoot with ingrown toenails. So what exactly causes this pesky problem? To answer that, we need to delve into the pathophysiology of ingrown toenails. Imagine your toenail as a ship sailing on the skin sea. Ideally, it should glide smoothly, but sometimes it veers off course and starts digging into the surrounding skin, becoming an unwelcome invader. This intrusion results in inflammation and pain, the telltale signs of an ingrown toenail. So why does this happen? Well, several factors can steer the nail off its intended path. One of the prime culprits is improper nail trimming. Cutting your nails too short or rounding the edges can cause the nail to grow into the skin. Next up is the issue of tight shoes. When your toes are constantly squeezed together, it creates a pressure environment that encourages the nail to grow inward. And lastly, we can't ignore the role of genetics. If your parents or grandparents struggled with ingrown toenails, there's a chance you might too. It's all about the shape and thickness of your nails, traits you inherit from your ancestors. While the pain is the immediate concern, if left untreated, ingrown toenails can lead to serious complications. Infections can set in, the skin around the nail can start to overgrow, and in severe cases, the infection can spread to the underlying bone. So while it might start as a small annoyance, an ingrown toenail can become a significant issue if ignored. Now that we understand the problem, how can we fix it? Well, the answer to that question lies in a range of treatment options that are available for ingrown toenails. It's always best to start with home remedies. You can try soaking your foot in warm water mixed with Epsom salts for 15 minutes a few times a day. This will not only alleviate the pain, but also help in reducing the swelling. You can also gently lift the corner of the nail that's ingrown and place a small piece of cotton underneath. This can help redirect the nail to grow outward instead of into your skin. However, if the problem persists, it's time to seek medical aid. Your healthcare provider may suggest a procedure to remove part of the nail. In more severe cases, the doctor might remove the entire nail along with the underlying tissue to prevent recurrent ingrown toenails. Let's not forget about antibiotics. They may be prescribed if an infection is present, which is often the case with ingrown toenails. That being said, it's paramount to remember that these treatments are not a one-time fix. Ingrown toenails can recur, especially if you continue to wear tight shoes or trim your nails incorrectly. Therefore, it's crucial to take preventive measures, which we'll discuss in the next segment. But remember, prevention is always better than cure. So stay tuned to know more about how you can prevent this painful condition. Scene script. How can we avoid the discomfort of ingrown toenails in the first place? Well, prevention is better than cure, and there are a few easy measures you can take to keep your toes in tip-top shape. First and foremost, let's talk about nail cutting technique. You might be tempted to round off the corners, but it's best to cut straight across. This prevents the nail from digging into the skin as it grows. Next, give your toes some breathing room. Wearing shoes that are too tight can compress your toes and force the nails into the skin. Opt for well-fitted shoes that provide ample space for your toes to wiggle. And last but not least, maintain good foot hygiene. Wash your feet daily and keep them dry to prevent bacterial and fungal infections. Regularly moisturize your feet to keep the skin pliable and less prone to cracking. By taking these simple steps, you can keep your feet happy and pain-free. In conclusion, ingrown toenails are a common but avoidable problem. To recap, these occur when the edge of the toenail grows into the skin, causing discomfort and sometimes infection. Treatment ranges from home remedies to surgical intervention, but remember, prevention is key. Regular, correct nail trimming and wearing well-fitted shoes can save you a lot of trouble. Stay vigilant, take good care of your feet, and you'll keep this pesky problem at bay. Don't forget to subscribe and hit the bell for more health tips and advice. Keep those feet healthy.